In this week's Health Check, we are going to talk about what is vascular disease and the importance of knowing the risks, symptoms, treatment, and preventative measures for protecting your blood vessels. I'm joined by vascular surgeon Dr. Mohit Srivastava to learn more about the topic. Dr. Srivastava, thank you so much for joining me.
Oh, thank you for having me.
Of course. So can you just tell us kind of what are vascular diseases and how can people get them? How does it happen?
Sure, yeah. Vascular, as we all kind of have an idea about, is a wide array of topics, but the biggest thing I can tell you about vascular conditions in general is that we always look at it in terms of 6 subsets or 6 categories of vascular conditions. And that's not by the book, that's just more of a generic way we look at it, but it deals with 6 different aspects of the body. The first that we look at are these carotid arteries in the neck, and whether or not they have the ability or potential to cause somebody, unfortunately, a mini stroke or a stroke from plaque or blockage building up in them. The next one we look at is that same hardening and blockage, but down here in the legs, in the circulation in the legs. And what we look for is if folks are having any trouble walking, if the muscles are cramping up or burning when they do. If it gets really severe, it can start to affect the feet. And if it gets really severe, it can start to lead to things like wounds and ulcers at the bottom of the foot that folks don't always know how they got there. But that's usually what we look at with what we call peripheral artery disease. The next subset that we look at is aneurysms. And aneurysms are nothing more than a weakening and a widening of one of the original blood vessels that you have in your body. And they can happen anywhere. But the biggest things we worry about is whether or not they form a lot of blood clot in them, or even worse, if they burst. And what we want to do is try to get to them before that happens. The next subset we talk about has to do with the kidneys and the bowels, and really the blood flow going to them. Sometimes if we have blockages in those arteries, it can give us really high blood pressure. It can cause our kidneys to start to fail. And more so than that, it can actually diminish the blood flow we have to our intestines, so when we eat, it really hurts us. The other subset we talk about is veins. And this is something that can occur across all age groups, even as young as teenagers, all the way up to 80 and 90 years old. And those are things that we see swelling from, varicose veins and spider veins from, and even blood clots, whether you have one now or you've had a history of them. And those are the things that we want to treat so that the veins can flow better and the symptoms in the leg can improve too. The last thing that we deal with, or that we talk about mostly, is that unfortunately a large population of folks are currently on dialysis. And what we need to do is be able to get them a proper access, whether it's through a minor operation in the arm or a catheter that we can put in that allows them to get good treatments so they can get stronger and feel better.
So I want to ask too now, because I heard you mention for 1 or 2 maybe of the 6 different diseases that you mentioned that they were for any ages. Now, are they some of those other ones now more targeted towards its older people that get these kinds of diseases, or can those be young people as well?
No, it's a really great question. Technically, anything could happen across any age group, but usually what we see with the vein issues is that that really happens across all age groups. Everything else, believe it or not, it is typically as we get older. And most importantly, because it takes time for hardening and blockage to build up in those arteries to the point where they get to a breaking point and start to cause problems. So typically those are folks in the 6th, 7th, 8th decade of life that we're seeing have those problems. But it's definitely a great question because some we can see everywhere, some we tend to only see in older folks. But in theory, anything could happen anywhere.
Okay, and so what kind of causes these diseases? You know, what things lead to people contracting these kinds of diseases?
That's another great question, and the best way that I could answer it for you is to tell you it's what we call multifactorial. It's a combination of different things, and when we've looked at this and we've had the benefit of studying this over the course of a half a century to a century now, what we found is that it's kind of a mixed basket of a few different things. A lot of things we call risk factors are things that can lead to having hardening and blockage in the circulation. And that comes down to things like diet, exercise, lifestyle modifications, the biggest one being preventing or stopping smoking if you are doing that currently. Things like that, along with even things like genetics we see, it can run in families. And those are both things, or those are obviously a huge proponent of things
Right.
that can lead to this sort of problem. But a lot of it boils down to age, some of the risk factors that are modifiable, and even genetics or family history can play a role.
Okay, and so I do want to ask too, how can you prevent yourself from getting these vascular diseases? What advice would you have for our viewers out there?
Yeah, this is one of the biggest things that we try to impart on folks, you know, whether we're in the office or just anywhere, because it is the one thing that we can all try to do to help ourselves prevent these things from coming on. Ideally, I wish there was a way that I could tell you there's one or two things you can do and you'd never get it. But the
Right.
truth is, as we get older, these are all things that a fair amount of us are going to have to deal with, because it's things that we are going to have. The biggest things we say are as far as your lifestyle, avoiding risk factors, and there are some medications that a lot of folks will be on anyways, and if not, we can place them on to try to help stabilize this pattern. The biggest thing we say is, with a healthy diet, exercise involving activity about 30 minutes a day at least if you can, and eliminating all the bad things that can lead to this, the biggest of which being is smoking. Those are the number 1 through 3 things you can do at home every day to try to help prevent these things from coming on. And a lot of our folks are already on medications because they do suffer from other conditions as well. But there are a few medications that deal with the blood vessels in general. 1 or 2 medications folks can be on are blood thinners that can help prevent the progression or even the occurrence of certain conditions in the vascular realm. The third is actually a medicine we typically use for lowering your lipids and cholesterols. And that's typically what they're used for, but they're also one of the few medications out there that have a possible benefit to stabilizing any blockage that you may have.
Right.
In terms of helping it not progress to worse levels. So diet, lifestyle, and medication are really the 3 biggest things to try and help prevent that.
And so the final thing that I want to ask you, you talked about a lot of good prevention steps there, things that can help people in the future to prevent them from getting these diseases. Are there other things like forms of screenings, or are there maybe any early detection prevention processes that people should know so maybe they can get ahead of the game?
Yeah, no, absolutely. And that is another proponent that all of us at Camden Clark Hospital and WVU Medicine in general are very, very big on, because that is one way you can know if you have something. For a lot of those conditions, symptoms will be your first sort of inclination, and those are the things that we talked about, those symptoms that you may notice in your everyday life. And that's where we're only a phone call away, and your primary care physicians, who are wonderful, are also only a phone call away. They can get you the proper testing, and we can know whether or not you have something like that. The other thing that we do here at Camden Clark and all of the WVU hospitals is we have screening programs where a lot of folks can come 3 to 4 times a year and be able to get a diagnostic ultrasound test to see if they have any of the things that we talked about. And the last thing we always talk about is just, if at all, you can know your family history. Because a lot of those things we can see run in families, aneurysms in particular. One of the biggest things we deal with are aneurysms in the belly, and what we always say is there's about a 1 in 5 genetic predisposition to having that. So 1 in 5 first-degree relatives can also have one. So we're always on the lookout for folks and their families and what they've dealt with throughout the years.
Absolutely. Well, Dr. Srivastava, thank you so much for sharing all this wonderful knowledge that you have on vascular disease and how to help people here in the Mid-Ohio Valley avoid getting it.
Sure, no, it's my pleasure.
Of course.